if you have surgery for prostate cancer.
Yeah.
It takes a while to restore the sexuality, but on the other hand, if you have radiation, it works good at the beginning and then it deteriorates after that. It works the opposite way. Yeah.
And then does it
then
come back after?
no,
Oh,
no, it doesn't.
That's
no.
permanent.
Yeah. I think for men, it hits them harder because men's sexuality is right there. They're jewels. They guard them very closely. And for women, they do.
Yeah.
And for they name them Fred and Albert. But anyhow, but with women, I mean, you have breast cancer. If you have breasts removed, you can have reconstruction, and they still work and they look the same, right?
Yeah.
They work the same. They look the same, okay? And with men, it's different. That's their masculinity, so to speak. And a lot of guys feel that if that part is gone, they're no longer the same guy. And I think having a support group is a good idea for guys in that respect, because it shows you that these guys are all out there doing normal things, and life goes on.
Yeah.
And having supportive partners is a great thing too. When you can talk about it, you can talk about it candidly. You have problems, you can laugh about it. You can joke about, like the Seinfeld episode, shrinkage. But you have a good reason for that, eh? So
Yeah. We've had a really good experience with our urologist, who really took an interest in restoring, his erections, and it's been really a very positive experience with a positive outcome. It's, it's come along, slowly. Well, we're now past 2 years, and it's working. And we felt comfortable with the urologist talking about it. And he made it a point, once the incontinence was, under control, that we concentrated on restoring the sexuality. And so I could say that that's been a really positive experience. Besides talking to the doctor, we got on the internet.
Okay.
And kind of, particularly Ed drove himself crazy, and he finally got to the point where he just had to say, enough.
Yeah.
I can't do this anymore.
It was too much.
It was too much.
Yeah.
It was overwhelming, scary too.
Yeah.
And so we just decided to focus on, okay, let's get our questions answered by the doctor.
It was very difficult, but you talk to as many people as you can, but it's still, I don't think you absorb that information to begin with anyway.
So you were saying something about when you went back to work?
Yeah, after Jim had his surgery and, he was back home, and I think he was still in the recuperation period, and I was working at the nursing station at the time, and I mean, this is just the way my emotions were. There was another day that the nurses were in the back kind of having a laugh, and not about any of our patients, but there was talk about erections and, what could be done with that. And I lost it. I just totally lost it. I was so upset, and not, like, it was just like, oh my God, like, that's gone from my life. And then I felt guilty, because I thought, well, so big deal. Like, as long as he's alive, that's the main thing. But you're kind of torn, because there's one side of you that's like, I'm not ready to have my life
to give it up.
That way, And do you find right before your husbands see the oncologist, they get a little tense? Yeah, I find that with Jim. Like, when he knows his appointment's coming up. And that's really hard, because you think, well, you've been fine.
Yeah.
Because it's hard for me to relate to that, right? And I know he'll have his PSA done, and then he'll always, I wonder how it is, and is very worried, and it's understandable.
I think that, life for us is good. We're retired, and he's recovered, and he kind of forgets about the cancer, and I think then the appointment comes up,
Yeah.
and you're hit in the face again with, oh yeah, I'm a cancer survivor. You know,
Yeah.
Yeah, you have to sort of sit back and think about that. Oh yeah,
Right. Yeah.
my husband had cancer.
But I don't now, because I guess I like to think that it's over, you know.
Because everything's
Right.
staying nice.
And I
Yeah.
think that was also something that was very difficult when we got the diagnosis, because I was sure that he was fine, and Jim was pretty sure he had cancer, but I was like,
Well,
the PSA wasn't that high.
Yeah, actually, really
Everything's fine.
thought that too.
Yeah.
You know.
And so it was a bit
Yeah.
of a shock.
So he phoned me
Yeah.
at work and he said, I said, so what did the doctor say? He said, I got cancer. And that was devastating.
Yeah.
Yeah. What about your husband? Ed, was he thinking that
he was
everything-
thinking cancer.
Yeah. And what about
was.
you?
Yeah, I was too. By the time he had the second, not initially, but by the time he was having the second biopsy, where there was just something
Yeah.
that the urologist didn't feel was right about the first one,
Yeah.
I
Then-
was
then you
thinking
get
we
that.
weren't surprised. We were and we weren't. I mean, there was always a hope that it wasn't going to be, but it wasn't a total shock when it came. But I've gone to all his appointments with him. I think he appreciates it the second pair of ears. 'Cause
Yeah.
I think sometimes when the doctor will say something, sometimes he'll focus on it and then he forgets what else, comes afterwards. So even now I still go with him.
Do most men go to the prostate support group like right away on diagnosis, or do they wait till after their surgery or
Some
treatment?
people
or-
go before, and some people don't start till after. Yeah. Some people never go.
I know that we had one gentleman that came probably about a year ago before.
Oh, okay.
And really he came to talk to other men and asking really specific questions. And his sexuality was a big thing with him.
I think that's the main concern with the guys, sexuality and the incontinence.
Yeah.
A big thing. Yeah. Yeah, so that's kind of good too to come before.
And I think he was looking for hope and
Yeah.
you know.
And what
And then
what
he
did
came
you
back after. And,
Yeah.
Yeah.
Like he talks to guys who had surgery. What was your experience? If they've gone through radiation, what was your experience? Or the hormone therapy? So, sort of make a decision about how the other experiences were and what they should be doing themselves. I says, well, a couple of friends mentioned to him, we have a support group, why don't you come? And actually the doctor had suggested, like there's a support group. And Willie thought, no, I don't really need, he said that you're my support, we'll just go through this together. And I'm thinking, he really needs to talk to other guys. So one of his bowling buddies started talking to him one day, says, why don't you come to one of the meetings? And actually, there's quite a few guys that he bowls with that had prostate cancer surgery. So they started talking. And he went to a meeting and he came back just glowing, like, hey, I like that,
Yeah, good.
And then they've had guest speakers and so
Yeah.
it's a good thing.
I've gone to the prostate support group meetings with them. Sometimes I'm the only female there. Sometimes, one or two more will come. But they've had some sessions, some video conferences.
We were at
on
the video conference
that are
one
really
just
good.
recently.
Yeah. The last one, the urologist talked about, taking up to 4 years.
That's right, I remember that.
And, that just, I think that's hopeful, hearing that, a year or 2 years and you've hit the wall and that's it.
Yeah.
Or, that's not it.
Yeah,
You can still have rehabilitation up to 4 years.
With Jim, it was that fear to begin with of, oh my God, is he going to die? Like that. And then once, okay, no, he's not going to die. He's going to have the surgery and then you go through with all of that. And then after that, it was, this has really changed our lives, because it has. And I think I was maybe, 51 at the time. And I'm thinking, oh my God, like, I'm only 51. Like, to me, that's, young, and he's young. And so it's how do you deal with that? And And yet, I don't know, I think you just kind of put one foot in front of the other, and you start to get back into the motion of life. And, you know, when he got back to work, and all of a sudden it's okay, we've got this life, and then there's that cancer.
Do you find that your husbands are just as active as they were before their surgery now? Are they to that point? Like physically?
Oh,
yeah.
Jim certainly is, yeah.
Yeah.
I mean, when I'll never forget when I left Toronto, because when he stayed down for 2 weeks, I had to come back to work. And our son-in-law picked him up from the hospital, and he was in a wheelchair and kind of all bent over, and off they went, and I was just a mess. And I flew home the next day, and then 2 weeks later he flew home, and he kind of strutted off the plane, and I'm like, oh my God.
You're like, wow.
I can't believe the difference, you know? And that recuperation period, he just got so much better. And I mean, by the time he returned to work, he was walking long walks, and it doesn't affect his, I don't think it affects how he is physically at all.
Well, he seems pretty active.
Yeah, he is, and he's strong, and
And what about Ed? Is he back to his
He's
usual?
really back to normal. We've just come off a 6-day canoe trip, and we did 2 very long, arduous portages. and he managed it.
Well, there you go.
Yeah, carrying packs in the canoe, and
Oh, that's awesome.
yeah.
No, I mean, it doesn't work out for everybody, but I think just, you know, talking like this, it does give hope and encouragement to other couples. Well, and there's a million questions.
Yeah.
And you haven't got the right answers from the doctors. And to talk to someone who's the wife of someone who's gone through it, you know, sort of talk about what they're feeling, what their emotions were going, what happens now.
Yeah.
And I think this sort of thing is really important too. Anybody who's going to have prostate surgery, get as much information as you can. Ask a lot of questions from your doctor. Put down your questions and get some answers. And if you can't get them from the doctor, talk to someone who's had prostate cancer, talk to their wife, and get the story. Don't lose hope. It doesn't mean they've got cancer. It doesn't mean that this is the end of everything. I mean, your life changes, yes, but it doesn't have to change for the worse. It doesn't have to change in a bad way. A lot of good things can happen. Couples get closer. They start prioritizing because all of a sudden they might think, okay, this may be the end of my life. So they start thinking about important things. What's really important here? Just, you know, keep your spirits up. Things are sort of, at first, it's really hard to deal with this, you know, coping and things that happen post-surgery. But this will get better, just to sort of keep telling people that it's going to get better.